Good morning, good afternoon. My name is Aros May. I'm with the IBP initiative. And today we are starting our new webinar series of the Interagency Working Group on SRHR and HIV linkages. While we're waiting for Dr. Narasimhan, we are going to start the webinar now. So I'll pass it on to Team Sladden.
Hello, everyone. Welcome, and it's my pleasure to welcome you all to this first in the series of webinars on SRH-HIV linkages convened by the Interagency Working Group. I'm at a loss that our colleague Manjula is not with us as yet. She was going to host this webinar, but unfortunately she hasn't been able to join us just yet. So I hope she does manage to come online soon, but we won't delay. We'll launch right into it. So just a few introductory details. We are going to record the webinar, so if there are colleagues who can't be with us at this time, you'll be able to catch it later. We very much want to make this as interactive as possible. We have a rather packed agenda, but I hope there is time for questions. And in the bar on the side, you can submit chat requests or questions or suggestions. So please make use of that as one way of interacting, and hopefully we'll have time for some actual discussion. You'll see there the toolkit website is the link is there for further information, and we're going to focus a lot on the call to action today. Next slide. So yes, welcome. Well, I'm standing in for Manjula now for the welcome. Then we're going to look at some of the data and monitoring we have. Jon Hopkins will introduce the country infographics that have been developed for specific countries around linkages between SRHR and HIV. Daniel McCartney of IPPF had hosted a very interesting pre-conference at the AIDS 2018 International AIDS Conference in the Netherlands, in Holland, and he'll be talking about that. Then I'll go into a bit more detail on the call to action, which was launched at the AIDS conference, and we'll have then some Q&A. So that's the run of show. Here you have our three presenters. Not a very good gender balance, I must say. We didn't manage very well there, but we were hoping to have Manjula to host us all, but Jon and Daniel and myself will be the presenters today. Next slide. So to launch right into it, we have Jon Hopkins first. We'll talk about the country infographics. I'll hand over to Jon Hopkins now. You have a short bio of Jon there. Thank you, Jon.
Thank you very much, Tim. So first of all, I apologise if my connection dropped in and out. So somebody do shout if I'll end up talking to myself and not to this group. So first of all, I'm going to link is infographic snapshots. Now, next slide. And can I have the next slide?
Jon, we're having, sorry, Jon, we're having trouble hearing you. I don't know whether we can do about that.
Let me try again. Is this any better? Okay, hopefully this will work a little bit better. So the purpose of the infographic snapshots is to graphically provide an overview of national level data. And we tried to get data that covered the full scope of SRHR and HIV linkages. But linkages is sexual reproductive health and rights is a big area. HIV is a big area. And actually we came across more than 150 indicators that covered that scope. But what we wanted to do was, there's lots of data in lots of different sources. And instead of just saying, look, here's another table, here, go to UNAIDS, go to WHO, go to UFPA, UNICEF, go to the World Bank, all these different sources, we actually wanted to say, look, let's put this in one place so you can easily review the data from multiple sources. You can identify the gaps that require a particular focus, but also then see the gaps that need to be filled. So this was done under the auspices of the Interagency Working Group, but with collaboration and a lot of funding and support from UNFPA and WHO and IPPF. And then UNAIDS provided lots of support on the data, and USAID also provided support in putting this together. And then the different snapshots had different country partners. The Ministry of Health often also reviewed and signed up to the final product, as well as the IPPF member association in country. So there are snapshots available for 25 countries. They include Bangladesh, Indonesia, Botswana, Ethiopia, Lesotho, Madagascar, Malawi, Mozambique, Namibia, South Africa, Swaziland, Tanzania, Uganda, Zambia, Zimbabwe, Chad, Cote d'Ivoire, Nigeria, Togo, Lebanon, Tunisia, Guinea, Cameroon, Mali, and Ghana. So there's lots of different countries there, mainly African focused, but also some Asian countries. And other countries have shown interest in actually getting developed. If you go to the bit.ly link on the slide, you'll actually find all the snapshots. For French-speaking countries, a French version is also available. Next slide, please. So what you'll find in each of the snapshots is it graphically presents the data. So on the third page, there is the key intersections between HIV and SRHR. And the snapshot I've just taken as an example is Uganda. So you'll see that, okay, new HIV infections, HIV is a leading cause of death in women of reproductive age. New HIV infections, age-related deaths, prevalence, living with HIV, ART coverage, etc. Next slide, please. Also on this page, it looks at HIV-associated maternal mortality because it contributes to maternal mortality. It looks at gender-based violence, HIV transmission, the elimination of transmission, contraception, condoms, STIs. These are the key things that matter around sexual reproductive health and HIV, and they're key intersections. However, next page. The snapshot also looks at three key domains: the enabling environment, so the policy and legal areas, the health systems area, and also service delivery for integrated services. So for the enabling environment, we looked at, okay, do national HIV strategies talk about sexual and reproductive health? Do national SRHR strategies, whether it's a family planning strategy or a maternal health strategy, do they look at HIV? When they mention condoms, does an HIV strategy mention condoms to prevent STIs or prevent pregnancy? And vice versa, do SRHR strategies look at condoms with a reference to HIV prevention as well as preventing STIs and pregnancy? So we scored countries on those different strategies. We also looked at different laws and policies around people living with HIV, key populations, age of consent, etc. Next slide. We also looked at the enabling environment around stigma. And there was also, and this is data from the Stigma Index, and also women's empowerment, gender-based violence, are the key enabling environment areas that matter to both sexual and reproductive health and rights and also HIV. Next slide. Then we have health systems. So we looked at human resources for health, doctors, nurses and midwives per 1,000 people. We looked at training and supervision. Some of this data was taken from the rapid assessment tool that country did a few years ago. We looked at commodities, and we looked at the provision of integrated services. Next slide. So when looking at integrated service delivery, then it was very much looking around, okay, the elimination of mother-to-child transmission, but also the dual elimination of mother-to-child transmission of HIV and syphilis. So it's what's the data of the services that are ascertained to HIV and SRHR, what's the current data saying on those services? Next slide. Then we looked at, okay, well, there are certain groups which are at particularly high risk of both poor SRHR outcomes and also poor HIV outcomes. So we included a page which focuses on data specifically around adolescents and youth. Next page, next slide. And also that focuses particularly on key populations, men who have sex with men, people who inject drugs, sex workers, and transgender people. So that's the snapshot in an overview. Just to point out that the data for the current snapshots is 2016 data. I know we have 2017 data and some early 2018 data now available, but this was 2016. These were produced in 2016, so 2016 data. And there was a hope to start updating the snapshots, but on the first page, it actually shows what year the data is from. But we really hope that these snapshots, and for those who have used them, have found them very useful in saying, okay, it presents the data in one place. I can go to a meeting with government, or I can, as a government member, I can be at a meeting and I've got the data there at my fingertips. But it also shows where the data is currently missing. So if you look, for example, in Uganda, there's a lot of data missing around people who inject drugs and transgender people. There's just no data that's publicly or easily accessible. I will just say that for all the data we looked specifically, we worked with the UN partners and the Ministry of Health in country to verify and validate the data that we had. And so that's why it was great that the Ministries of Health in most countries actually signed off on the snapshot when it was finally produced. Next slide, please. So where can I find out more? Well, there are two places where the data is specifically, where these snapshots and other resources are particularly available. One is the WHO Reproductive Health Department. They have a linkages page that links to lots of different resources, including the snapshots, including an SRHR and HIV linkages index. And then there's also a toolkit, where many of these resources are also, which is toolkit.srhr.hiv, toolkit.srhr.hivlinkages.org. Thank you very much.
Thank you very much, Jon, for that overview. And I think it highlights the complexity of monitoring this very complex field. It's so comprehensive and a holistic view of SRHR, HIV connections and integration and interactions. And it's really very challenging to capture all that in an index. So it's all credit to you and others who've been involved in the development of this monitoring side, and we see it coming together with the country snapshots where people can get local data that's been validated and can really see where the gaps are and where we need to monitor further. So it's really the core of progressing linkages is ensuring we're evidence-based and can monitor our progress in this regard. So thank you very much for that. Okay, we'll turn to Daniel now, who is with IPPF. You have his bio there. And Daniel's going to talk about the IPPF pre-conference at the AIDS 2018 conference in Amsterdam. Daniel, please join.
Yeah, great. Thank you very much. No, I'm very pleased to be here to share with you all, what happened during the AIDS conference, during this pre-conference. But it does seem so long ago now that on the 21st of July, we held the first ever pre-conference dedicated to sexual and reproductive health and rights at an international AIDS conference. As you can see on the slide, that it was titled Breaking Barriers, Building Bridges for the Right to Decide. And this one-day pre-conference really aimed to create an inclusive platform for fresh thinking on the integration and linkages between SRHR and HIV, to explore new paths for connections and collaborations with organizations working on issues related to SRH, human rights, and HIV, and to really unite movements between sexual and reproductive health and rights and HIV communities. The next slide. And this pre-conference was coordinated by IPPF and Rutgers, the Dutch member association of IPPF, along with other pre-conference partners, AIDS Fonds, Dance for Life, Guttmacher Institute, International HIV/AIDS Alliance, Planned Parenthood Global, She Decides, UNAIDS, and WHO. So it was a real collaborative effort to put together this one-day program. The next slide, please. But you might be wondering, like, why at this AIDS conference in Amsterdam? Why is this the first time that we had the SRHR pre-conference? Well, it wasn't the first time we tried to get this on the agenda, but it actually came from, seeing the Dutch booth at previous conferences, and you can see this is the Dutch booth that was in Amsterdam this year. But SRH, as you can see on the next slide, has really been a pillar in the Dutch response to HIV for a long time. So the Netherlands is also one of the key initiators of the She Decides movement. And we were very fortunate to have Lillian Plowman as the opening speaker of the pre-conference. So being in Amsterdam and with the current climate, we thought AIDS 2018 provided the perfect opportunity to showcase the interlinkages and to really call for joint action to address SRHR and HIV together. And I think now that the conference is over, and those who were there, I'm sure you would agree that the conference really had many moments that were at the heart of why a united movement is needed now more than ever. From highlighting the condom crisis and safety concerns of dolutegravir during the peri-conception period, and to the impact of the global gag rule on the HIV response. This really did sort of showcase this throughout the conference beyond the pre-conference. So next, please. During the pre-conference, we also wanted to recognize that it was in Amsterdam that the International Community of Women Living with HIV, ICW, was formed during the AIDS conference in 1992. And during our pre-conference, we had Kate Thompson, the brilliant human rights defender, who was there at the beginning. And she was one of the keynote speakers during the pre-conference to give her perspectives on where we have come from and where we need to go. And interestingly and importantly, she reflected on ICW's original 12 statements to improve the situation of women living with HIV. And looking through them and reflecting, we could see they're all still relevant today, but also many of them remain unmet. During her talk, she was also joined by Tekala Atai, a young She Decides champion from Malawi, who gave a message of hope and commitment to address these unmet needs going forward. So this is a really good moment during our pre-conference to reflect on what has been done and where we come from. The next slide, please. But it was also an opportunity to showcase some of the more recent efforts and work, and one including the other Lancet Commission report that was launched prior to the AIDS conference. We know the AIDS conference was where the International AIDS Society Lancet Commission report was launched, but we wanted to really highlight the Guttmacher Lancet Commission on Sexual and Reproductive Health and Rights, as it really laid out the scope of the unfinished SRHR agenda. And we wanted to showcase how it provides this bold, evidence-based vision for SRHR going forward. And within this report, for those who have seen it, it does include an integrated new definition of SRHR, and a definition where sexual and reproductive health relies on realizing sexual and reproductive rights, and where all individuals have a right to make decisions about their bodies and to access services that support that right. So, but put more straightforward by Heather Boonstra from the Guttmacher Institute, who presented this during our pre-conference. She really stated that it is impossible to improve health without enhancing rights. And within this report, recommending the comprehensive package of essential SRHR interventions, which goes beyond the usual suspects, it importantly includes the prevention and treatment of HIV and other sexually transmitted infections. Next, please. And the report also recognizes the sexual and reproductive health and rights needs that are universal, but that certain groups do have distinct SRH needs that need to be addressed, including people living with HIV and key populations. And during this pre-conference, we also had Luisa Orza from the International HIV/AIDS Alliance, who shared her perspective on the importance of this report. And she really highlighted that, that they're helpful, that this new definition will change people's understanding of sexual and reproductive health and rights, raise political support and awareness, and ensure we focus on people and not figures. Next, please. But the core of this pre-conference was really the 3 panel discussions that were developed. Now, and these were formed by sending out a short survey earlier in the year to a wide number of colleagues and partner organizations to ask, what are the key challenges you are facing with regards to integrating SRHR and HIV? And through this survey, three key themes were identified: language, cooperation, and meaningful engagement. And from these key themes, we formed diverse panels for each of them to not just share, their experiences, but also to really share possible solutions going forward. The first theme focused on how we can better frame and align our language for joint advocacy and to ensure our well-intentioned messaging does not fuel the opposition. We heard excellent examples from how framing is being applied in Argentina for access to safe abortion rights, and in Uganda in work with politicians towards support of sexual and reproductive health policies and legal reform. The second theme of cooperation had a number of panelists, some from GMP+, Women Delivered, Dance for Life, She Decides. And it was during this panel that we had a critical debate to discuss about collaboration, that we really need to go beyond collaboration. We must join interests and priorities, and that those organizations traditionally focusing on HIV must also include access to safe abortion and comprehensive sexuality education, while the SRHR community must ensure to prioritize the sexual and reproductive health and rights of people living with HIV and key populations. And it was really discussed that both responses really need to do more to address sexual and gender-based violence. And it was in the third panel where we further unpicked the theme of meaningful engagement, which is among the many significant achievements in the HIV response. The panel had a cross-section of representatives from young people, people living with HIV, trans women, non-binary individuals, people with disability, and it really included a continued message throughout about nothing about us without us, which we all agreed that both the HIV and SRHR response needs to take more to heart. And the next slide, please. And reflecting on these challenges that were presented during the pre-conference, we were all very pleased to see many of these critical issues included within the Amsterdam Affirmation, including the need to scale up evidence-informed programming, promote gender justice and sexual rights, and address needs of priority populations. Importantly, the Amsterdam Affirmation calls for us all to stand together. And during the pre-conference and during the conference, we were encouraged to see so many people to sign on to this. So we really did support this call to action. Next, please. But the pre-conference was also an important launching point for other important calls to action. One, Tim will discuss after my presentation, but the other two I wanted to give a bit more information on. The first one was the call to action on the global gag rule, which stressed that we all have a critical role to play to stop or mitigate the harms of policies like the global gag rule, as they are hampering our hard-fought progress. While the full impact of the global gag rule will likely not be measurable for years, any claims that is having no impact on the HIV response are false. We heard many stories from local communities at the pre-conference and throughout AIDS 2018 that really showed that it's clearly having an impact on the health and well-being of people who no longer have access to local services that they so need. The last call to action on this slide, you can see it was one where at the end of our pre-conference, we joined together with the Our Bodies, Our Fight pre-conference event, which took place on the same day. And we wanted to jointly support the launch of a call to action supporting a united movement to address access to safe abortion everywhere and to end AIDS as a public health threat. So these were some of the key calls to action that were really launched during the SRHR pre-conference and promoted throughout AIDS 2018. Next slide, please. But it really was, during this pre-conference, we had so many amazing speakers and panelists that it's really hard to attribute some memorable quotes by all, especially now that it's a couple months behind us. But one of our talented rapporteurs really summed up the pre-conference in one sentence. She said, "We need to inspire a conspiracy of hope fueled by evidence-based outrage, which won't take no for an answer." And I think it was from these lessons and from the pre-conference and throughout AIDS 2018 that on behalf that IPPF in particular stood and continues to stand in solidarity with our communities, calling for an AIDS 2020 for all. And this is really an important message that we really want to stand, that we need to sort of have this joint action together and collaboration. But overall, again, I want to thank all of our partners and program advisory group who made this pre-conference possible. And thanks for listening.
Thank you very much, Danielle. It really was an excellent pre-meeting that set the scene so well for what we're trying to achieve here, and to really bring HIV out of isolation and ensure it's fully linked with our much broader SRH services. So your pre-conference was a great scene setting, and I love the quote, the aspirational quote. We won't take no for an answer is excellent. We have to push forward now and deal with all barriers and issues in how we will really integrate HIV within broader SRH services, and look for the broader links which you have expertly talked about there and were addressed in the pre-conference. I'm just going to remind people now, before I speak, we will wait for questions and answers after my presentation, which is next. You do have a chat box in the control panel where you can type in any messages. It says type message here. I hope you can all see that. So do feel free to submit questions or comments via that. And then after I've talked, we shall open it up for discussion, and Ados will lead off with that. So as Daniel mentioned, one of the other satellites at the AIDS conference was the launch of the call to action on attaining universal health coverage through linked sexual and reproductive health and rights and HIV interventions. This call to action, I'm going to, we go to the next slide. I shall look at how it was developed this year and just go through some of the details of the call to action. It's been auspiced and endorsed by many agencies now. And then we had the launch at the conference, and we are now thinking about some follow-up actions. So again, in your control panel, it's on the right-hand side on my screen, you have a handout, which is a copy of the call to action. You can click on that and download that if you don't already have it. So next slide. The Interagency Working Group on SRHR linkage and HIV linkages have really been behind development of the call to action, and there's been a series of consultations, and then we had our annual meeting. So it started off last year. There was a meeting in Wilton Park in England on linkages, which was really looking at outputs and trying to come up with recommendations for how we can better link SRH and HIV. And I've listed there some of the sort of underlying prerequisites for ensuring that this happens. And as I've said, it's a very complex area with multiple facets, but so a lot of things have to come together. And so many of the issues that eventually ended up in the call to action were highlighted at Wilton Park, and you see some of them there about political will and community engagement, an integrated approach, and the need for doing this in many settings, including humanitarian situations. So following that Wilton Park meeting, there is a report of that meeting if anyone is interested. We had our interagency working group meeting this year in Montreux in Switzerland. There are no official photographs of that because we all felt very embarrassed meeting in such a beautiful place, even though it was cheaper to meet there than actually in Geneva. But no, we were very fortunate to gather together, and we had many people, I think many are on this call now, who came to the working group meeting, and we discussed, we reviewed the Wilton Park findings, we looked at some of the progress and some of the specific integration and linkage projects that different organizations are undertaking, and then we broke into working groups in part of the meeting to look at what really is the content that we need to progress linkages. And we came up with 10 principles or key actions that were then included. And so if we just go back 1 minute, yes, after the meeting we had a small working group that finished off the editing, and then we circulated for comment and got endorsement by all the agencies and organizations who were involved. And finally, it was launched at the conference in Amsterdam. So just quickly, you have, next slide, you have access to the actual call to action. It's been published. And we have these 10 principles or key actions that need to occur. And a lot of this has already been discussed, but I can maybe highlight a couple of them. The first one, I think, is the essential one, which is about being people-focused and empowering communities. So it's really led and owned by the people most affected and people who need to receive SRH and HIV services, so that community engagement. This is not just a health system approach. This is the whole of society is engaged in shaping how linkages are rolled out, and we have a lot of community-led approaches where communities themselves take the lead in delivering services and interventions. The structural issues, number 2, is really about creating a supportive environment, commitment from leaders in government and community, so that we have a space in which to develop the linkages. And that's also reflected in number 3 about the structural issues of supportive laws and policies are needed, and we need to get rid of laws such as criminalization of behaviors associated with key populations and criminalization of HIV transmission, all of those harmful laws which really stop effective integration. Funding is obviously essential, both the allocation from donors, but domestic resources and support from national governments. And then a whole look at health systems strengthening and alignment and coordination. That's obviously an important part. We heard in the conference about many examples of where primary health care has been fully integrated, and we see the SRH services such as family planning, antenatal care, STI treatment and care, and how that is integrated in a one-stop shop, if you like, with the HIV services, HIV testing, HIV prevention, HIV treatment and care. Number 7, many partners are involved. This is a very complex area, and it needs to engage many sectors: government, society, community, donors, the private sector, the commercial sector also need to be engaged. And this is part, I think, of what we need to focus on now, how we get these partnerships really moving forward. The life course approach, very important. Every stage in life affects our health later in life, and starting right from the start, obviously. So we need to, in prevention of mother-to-child transmission and ensuring safe motherhood, ensuring mothers living with HIV have the SRH services they need for supporting their infants and families. And then research is very important, obviously. And lastly, we need to be open to new ideas and innovation, as things are always changing. We have now much more, shall we say, self-care and self-testing of HIV. So the whole area of self-care is one that will be growing exponentially in the future. And how do we ensure a holistic view of both SRH and HIV issues are reflected in when people are undertaking their own health interventions for themselves, not necessarily with guidance always from healthcare providers. So this was a consensus view. This came out of the Wilton Park meeting and then was refined in Montreux by the interagency working group, and we came up, these are the underlying conditions that need to be in place. You could say they're probably relevant for many other parts of development, but they're certainly key for the progression of linkages. Next slide. So here we have a list of auspicing organizations that have signed up, and you can see I think it's about 40 here that we have. We're certainly open to other organizations who want to sign on, although we have printed, but we can reprint the call to action if other agencies and organizations feel they wish to join also. So it's really an open partnership with, and you can see the diversity here of so many different community aid organizations, development partners, and other agencies involved in sexual and reproductive health and HIV programming. So it's really diverse, and everyone can contribute in a complementary way. And as I say, these partnerships are what are going to be really key in progressing the linkages. Next slide. Okay, so at the AIDS conference, we had a high-level launch, a high-level meeting that was launching the call to action. And I won't go through here, but you can see listed here, we had some opening remarks from leading executive directors of UNAIDS and UNFPA. We're very fortunate to have Her Excellency Monica Gingos, the First Lady of Namibia, who gave some very inspiring remarks to launch the call to action. Namibia, I think, is an excellent example where this integration of SRH and HIV has occurred at the primary healthcare level, and then really making great strides in this integrated approach. Now you can see here we had a very diverse panel of speakers who spoke about the 10 key principles of the call to action. We heard some evaluation results from Gibson Malanga from Zimbabwe, who've been working with the World Bank and others there to look at the positive impacts of linkages. And then we had closing remarks from WHO. So next slide. We had a copy of the call to action printed there and framed. You can see at the bottom of the podium of the picture, and all of the panel members here are in turn signing the call to action. So expressing commitment of all our organizations to progressing this great initiative. Next slide. Okay, so that was the launch, and now the hard work really begins in how do we drive this forward, and how do we use the call to action as a framework for progressing linkages in practical terms. We've circulated and please continue to circulate the call to action as a guiding framework. Jon has talked about the linkages index and the country snapshots, the infographics, and as we mentioned earlier, these are critical in assessing the local situation and identifying gaps and exploring opportunities where different countries can try to progress linkages and see where they need to work to prioritize areas that need attention. Perhaps it's working more with women living with HIV, or key populations who are at risk of HIV, or looking in the primary healthcare setting, where can we better integrate a one-stop shop service? How can we bring in STI treatments? All sorts of local issues that need to be explored so that we get a comprehensive approach. There's going to be continuing a lot of capacity building and circulation of relevant normative guidance. We have a huge number of tools now that, and some are listed here, which are all promote an integrated approach to service provision and community empowerment and community engagement. So certainly the guideline for SRHR for women living with HIV, very much an integrated approach there. We have the key population HIV implementation tools. They also look at holistic, comprehensive programs for key populations. Critical to all of this is ending discrimination in healthcare settings, so people living with HIV and others affected by HIV feel safe and able to come forward to seek treatment and take up services. And discrimination is one of the key barriers there. In various settings, we are looking at a comprehensive approach. UNODC is updating their packages. Just as an example here, we have the PMTCT package in prisons, and also a comprehensive package of interventions for HIV, which UNODC, WHO, and others are engaged in updating those holistic integrated approaches. And we now also, it was apparent at the AIDS conference that other populations, such as Indigenous people, we have rising rates of HIV in many Indigenous communities. So again, there will be a need for a integrated package of services and community engagement, community leadership, political will and funding. All of the things we've talked about in the call to action need to be utilized and taken up in our work with various people. I'm sure there are many other examples of normative guidance. We have the Sphere handbook for work in humanitarian settings, which is also a very integrated package. So all of this, I think we will benefit from highlighting the call to action and the 10 key principles. We have a couple of multi-country programs. Well, I should say one at the moment. We have great progress in Eastern and Southern Africa. They've had a linkages project for the last many years. I don't know how many years now, but certainly at least 5 years in Eastern and Southern Africa. The linkages project has now into its second phase of a new program supported by Sweden and other donors. And we have 10 countries there where rollout of these integrated services and a holistic linkage approach is really coming to fruition. We have a proposal that's being submitted now for a linkages project in another 12 countries, not in Eastern and Southern Africa, but in many other parts of the world. Progress has been made. We have countries in Asia, in the Pacific, in South America, many areas that we really need linkages everywhere. So it's going to be, we're going to need everybody engaged, and there's no shortage of work. So we really welcome all comers to progressing linkages in many settings, even in low epidemic settings where there's low rates of HIV. Integration and linkages is the key to keeping it that way and ensuring that some epidemics within key populations and concentrated epidemics don't get away, and that we don't move to escalating HIV rates, as we are seeing now in Indigenous people, where they need more attention and more support to maintain low levels of HIV. So linkages are relevant for all countries, and we hope to work very comprehensively with everyone in terms of progressing them. I think that's the end of my speech. Yes, there you have another way of accessing the call to action. And as Jon mentioned, please make use of all the resources that are online, and we're all available to discuss what is needed in further resources and to highlight and progress, build capacity and use of the normative guidance that we do have. So I'll stop there and I'll hand back to Ados. Thank you very much, everybody.
Thank you very much, Tim, and thank you, Jon and Daniel, for sharing this important information and updates with our audience. We had over 90 of our colleagues from around the world joining us today. And now we have come to the time for questions to our panelists. So I apologize on behalf of Manjula Narasimhan, who couldn't join us. She unfortunately experienced some challenges connecting. I have a couple of questions for Jon, if you're still with us, Jon. The first question is from our colleague in the Latin American and Caribbean region. Are the snapshots available for the LAC region?
Thanks, Ados. So the snapshots at the moment are not available for the LAC region. There is no reason why they shouldn't be. So it just needs the current snapshots were developed based upon a criteria of a country wanted it, and then the priority was given to countries who were part of the UNAIDS fast-track countries. Other countries then said, no, but we want one, and here is and UNFPA actually were kind enough to find the funding to support the development of them. There are countries that I've heard through WHO, I think a couple of Caribbean countries that would love a snapshot. So it's very easy to develop. It just requires a little bit of budget from somebody in order to do so.
Thank you, John. And a follow-up question related to the information on the website. Is there any context or population-specific focus, for example, populations living in slums or refugee migrating populations available in or incorporated into the infographics information?
So the infographic information, in developing the template, we try to keep it generic yet specific. So it was data that was available and important for most countries. However, there was seen a need to, okay, but we need to, certain countries face very specific challenges around reproductive health and rights and HIV. And so there is a page that in some snapshots has data in and other snapshots does not. South Africa is a very good example. They said, no, we need information about TB. TB is a big problem here, and we need to put some TB data into our snapshot. So they added that. It's on the page after the key populations. Other countries said, no, it's enough data, and we're happy with this. I will say, in terms of so it's very population specific, such as people living in slums or refugee migrating populations. Finding data, it can be harder in these areas because it might be through a project, but not routinely collected more broadly. I stand to be corrected on that, but we were trying to look at data that was ongoingly collected and ideally through international data sources, though we did go to country sources as well for support with a lot of the data.
Fantastic. Thank you so much, John, for that answer and for the colleague who actually asked the question. I have another question for any of our panelists who would like to answer it. So John, Daniel, or Tim. And this question is related to the funding from PEPFAR. So given the disproportionate amount of funding that PEPFAR provides globally, how are linkages incentivized?
Thank you. Well, it's Tim here. Well, I don't know, Daniel or John, feel free to jump in. I think that this is a matter of dialogue, and I think we've heard over the years how we all see that linkages is important and an essential way to go in order to increase the coverage of HIV and also to provide the SRH services for people living with HIV. So I'm saying it's a win-win situation. So it's we've come to a consensus and agreement about that. We still see a lot of barriers, and certainly sometimes we see organizations perhaps reluctant to take up linkages because it's difficult to ascribe attribution of, if you have an integrated program, you're not quite sure what is causing what, and it's a combined output or impact of an integrated service, and that's more difficult to evaluate. So those are some of the concerns I know on some donor sides, that it's easier to monitor a standalone HIV program. So we do have to have a dialogue to see integration and linkages is the way forward, especially with declining budgets for standalone programs such as HIV. We see market reductions and the need for countries to take over domestic funding of this, and they're going to need to provide that in an integrated way. So as I said, I think dialogue is key here in order to get all agencies to understand this, and so that we pull together and progress this in a comprehensive partnership. John or Daniel, I don't know if you care to add to that.
Sure. So I guess building on what Tim's just said, the question is how are linkages incentivized? Now, I have been in countries in Southern Africa where in the past, because of vertical funding streams, they had baskets of condoms that were for HIV prevention and baskets of condoms that were for pregnancy STI prevention. Seriously. And we are way past those days now, because they were seen as, how do you actually talk to somebody and say, would you like to prevent HIV tonight, or actually another STI or a pregnancy? Because it's a multi-purpose prevention technology. And so what we need to do to incentivize is, yes, as Tim said, it's more sustainable. As Daniel said earlier, we need to see people, not numbers. And we actually need to show that, no, by addressing somebody's needs holistically, which can be done way more efficiently if it's the same healthcare provider in the same room during the same consultation, especially at primary healthcare level. If we can do it in that way, then actually we can meet the needs, we can meet the HIV goals, but we can also meet other goals around contraception, around access to contraception, around TB, around antenatal, around STIs, around so many different things. And so we just need to show how and why those links and that providing services in an integrated manner actually supports and doesn't harm the provision of, for example, HIV services.
Thank you, John. If we could move to the next question, and this is a question for Daniel and Tim. Could you please tell us how the role of the private sector can be catalyzed to make service provision more efficient and effective in this work of linkages between the two sectors? And how was that discussed at the call to action and at the pre-conference?
Yeah, this is Daniel. I'll go quickly. This was one of the areas that was discussed during the pre-conference, in particular during one of the panel discussions where we had talking about cooperation, and we wanted to talk about cooperation with the private sector. So during that, we had at least a perspective from Yale, from Dance for Life, to express some of the work they've been doing around social entrepreneurship and such, and then also others sharing their partnerships with the private sector. And so we heard different examples of that. But I think it is that's exactly what we need to do when we talk about true collaboration and cooperation, is looking at the different sectors. So we have examples of where we do need to work for the likes of the private sector to be able to improve the SRHR and HIV needs of their workers or employers, or maybe it is those organizations like Durex and such who are able to work with us about how can we further support to ensure wider availability of condoms in countries, and just sort of to really widen the supply chain. So I think those are the discussions we had, and I think that's some of the things that we need to take into consideration as well. And I'm sure Tim has something else to add.
Well, thank you, Daniel. Just building on that, and if we stay with condoms for a moment, it is critical that we engage the private sector here, and it is increasing. I think we're in early stages, and a lot of development partners have not really worked much with the private sector. It's an area that we're learning on, and we're evolving. But for condom programming, I think we see a pattern of movement from earlier. We had a great amount of delivery of free condoms, with donors and governments purchasing and providing condoms for free in the early stages of the epidemic. We've moved into social marketing, where people are paying a reasonable price for condoms and perhaps valuing the product more, and or cost price is issued. And now we're moving into an area of more commercial engagement, and as countries develop and their economies grow and people prosper, people are able to purchase their own condoms, and we have to look at working with the private sector. This is just an example on condoms, where to ensure that we have ethical investment, that we have products that meet people's needs, that there's a lot of work now on lubricants and ensuring that they are safe to use and that they are don't have sexual and reproductive health implications or negative consequences. So working with the private sector in delivery of commodities and interventions. As I mentioned earlier, we have a lot of self-testing and self-care coming in, and that will be increasingly not involving healthcare providers. So there'll be direct links between consumers and the commercial sector who are producing products used by consumers. It's a dialogue, and we need to have the private sector at the table as we look at how to provide these fully linked and integrated approaches to both SRH, HIV, and other issues. So thank you.
Thank you, Tim, Daniel, and John. And one last question. Before we close, I realize we're running a couple of minutes late, and I apologize for that. But I think this question will offer us an opportunity for reflections from our panelists as well. The question is, any practical thoughts on how to make integration happen? How to get providers and facilities to buy into the value of integration to sustain it?
John, do you want to come in on this?
Okay, how to make it happen? Now that is a question I've been involved in this and asking that to myself for the last 12 years or so. How to make it happen? The places where I have seen it happen very well is, and Tim mentioned the Southern African, Eastern Southern African Linkages project, and there they have been trying to do exactly this for the last 7 years. And where I've seen it work is, yes, they've tried piloting it, but they've got and so they've tried it in practice, and it has worked really well, especially primary healthcare level. Then what they've done is actually in the places where it's worked, they've taken other people to sites on site visits and said, look, the health providers, also regional and district health managers, and said, look at how integration is making a difference. Both and the providers like it, the clients like it. It's not affecting the data. It's actually improving our operations, and that has helped things to spread. I've also seen it in IPPF member associations when I worked at IPPF, that it's actually when you make the change, and in IPPF they added HIV services to existing sexual and reproductive health services. It was, whilst it's not always plain sailing immediately, actually the clients go, I much prefer this, rather than being pushed from pillar to post. It's like, okay, I have to walk through the door that has ART on it. Well, I don't want to walk through that door because it discloses my status. And it's go and see where it's actually happening, and talk to either Tim, Daniel, or myself to say, well, where can that be close to where I am? And we can actually show you an example that will go here and see, and then see actually how it's working and what setting it's working. And I think that's how we can actually say, because it's not something new, it's something that's been going on for a while. It needs scaling. The small scale where it's happening, it needs to be really scaled.
I'd just add to that, I think looking at the call to action, especially the first two principles, community engagement, community empowerment, community advocacy, so that the people who are most affected are calling for a change in how services are delivered is crucial. And we need to have a safe space where people living with HIV and others affected by HIV are able to call for a change in how they receive services and how they are treated. And to balance that, it's a matter of the political will and the commitment from service providers and from governments. And we need to have sit-down meetings with everyone around the table in countries, within cities, within areas who are thinking about integration and linkages, and to have those initial meetings where people can express their needs and what they feel needs to happen, and we can then start the planning process and the rollout process of actually creating policies, shifting service provision, creating supportive systems within the health service, within other sectors like education, so that we, in that way, initiate the change, and then we can start the monitoring and start the rollout, and as Jon says, look at the pilot or the early adopters in some clinics and some sites, and then to see how to roll that out to other areas. It's very complex, but it requires people sitting down and talking to each other around the table and to see where they can see opportunities to move forward.
Thank you so much, everyone, for your thoughtful answers and recommendations. The questions that we didn't have time to get to, I will compile them and send them to our panelists so that they can answer them directly to you. Thank you so much, everyone, for participating. And with that, I'll pass it over to Tim to close the webinar.
Okay, thank you, Ados. Well, I want to thank Ados first. It's really been very excellently organized. We've been shepherded through the process very, very well, and it came together, all except, unfortunately, Manjula of WHO not being able to join us. And we really missed her engagement, because Manjula has been one of the key drivers of this whole process from the start, and it was a great shame she could not host the webinar and moderate. So I want to thank the panelists, both Daniel and Jon, for your expertise and commitment and inputs. It's been wonderful, and we look forward to working together with you, and for all of you, all the attendees who've shown interest in this. Thank you very much for your time and for joining. We look forward to the continued dialogue, and where, for those of you in country settings, WHO, IPPF, UNFPA, all of the partners who've signed on to the call to action, we're all committed and engaged, and we're all dedicated to helping drive this forward in national and local settings. So thanks again to everyone for joining, and we look forward to continued dialogue. And please do come back to us with suggestions, questions, and ideas how we can work together on this. Thank you very much.
Thank you.